Hi, I'm Laurie. I've been a professor of medicine for over 40 years now, specialising in cardiology and in particular cardiovascular risk factor management and cardiovascular pharmacology. Beta-hydroxycyclodextrin is marketed in Australia and in the USA under the trade name of Cavadex. There appears to be two major and separate effects of cyclodextrin in ischemic heart disease. And there's an immediate one which comes from the direct pharmacological effects of cyclodextrin, which has been well documented in animal studies and in human studies using bench stop techniques. The second interesting and perhaps most important feature of this compound is that it seems to be able to reduce the size of plaques. In other words, cause regression of atheromatous plaques in patients with ischemic heart disease. So we get an additional effect after the resolution of symptoms, which we can demonstrate quite well. Cyclodextrin has therefore a bimodal function, one which is short-term, improving vascular inflammation, reducing the symptoms of angina, but in the longer term, it holds the promise of causing regression of plaque, something that we've been unable to achieve with any other form of medical treatment thus far. The potential importance of cyclodextrin can't be underscored enough. Cyclodextrin in the form of Cavadex at this stage has more safety data and more knowledge about the pharmacology than what we knew about the statins when they were first introduced. I think that there's a potential for this treatment to be even more important and have a greater impact than what statins have. And certainly it's the greatest advance that we've had in cardiovascular pharmacology for the treatment of atheromatous plaques since the statins came on the scene. To put it into perspective, we have a potential treatment which may reverse coronary artery disease. Coronary artery disease is still the #1 killer worldwide. And if we can make an impact using a medical treatment rather than surgical interventions, which have their own limitations, this would make a huge impact on public health.